first of all, my testing wasn't just genetics. It was environmental, brain, lots and lots of tests. And the overview for me personally, I did this as a communicator, mostly as a journalist, to find out what was going on and trying to tell the story. But I did find out a lot about myself. Probably the most interesting information was that I have an increased risk of heart attack, which I didn't expect. There were a couple of other things, but I also was somewhat relieved that I don't have a lot of really horrible things. And each of us will have our own results, and we'll find out. That's the whole idea of personalized medicine. Well, this is still really early days for most of this information. You know, the science is very, very young, and so much of it we hear about is actually, at least in my view and most others, not entirely ready for prime time. And we're having this interesting inflection moment here where there's a lot of information and data and new science like genetics itself that's coming out before it's really entirely useful and before it's really been entirely validated. And by validated, I mean it hasn't been fully tested, say in a clinical setting like in a hospital here, where you find out if these risk factors, and that's what they are, it's a percentage like 20 or 30% higher risk factor for, say, a heart issue or something. Are these issues real? And it'll still be several years, I think, before you've got a broad spectrum of genetic tests, especially, that are meaningful in a clinical setting. But there are some now as well. So it's a kind of future as much as a present. I think to the medical community, especially younger doctors, should be really demanding that this information that's out there, that their patients are bringing to them in some cases, you know, doctor, I just had myself tested for my genetics. These doctors should really push the establishment, the biomedical establishment, to make better sense of this data for them as the users of this data, because much of it is still in the research phase. And in my view, this is where I get to be a little bit of an activist as a policy person. In my view, we're creating a lot of data, but we're still not yet figuring out how to use it or even how to make it useful. So that's what I would be doing as a physician. From a practical standpoint, though, I think we need more education for physicians, especially for the tests that are already out there being used. I think as a parent, finding out any information about your child that might happen in the future, you know, in the healthcare area, is going to make you a little nervous. Even if it's fairly benign data, it's something that may or may not happen, because all of this is just probabilities. It may happen, may not. Your child may get the disease. I don't think we're quite there yet, though, as a society, to say test all of our children. And there's talk about that. A lot of parents want to have their newborns or even prenatal tested for different genetic disorders. And out in California, where I'm from, there's even a package of tests. It's over 40 tests that you can have. You're prenatally tested for different genetic disorders. It's clearly being done, but I think it's still a discomfort for us. It's something we're going to have to get used to. The biggest revolution that I think's occurred, and the biggest success coming out of the Human Genome Project in the 1990s, really has been rare genetic disorders. As it turns out, the way genetics works is if you have a major error in your genetics, Tay-Sachs or Down syndrome, other rare diseases that are clearly caused by a genetic factor, you can identify those now with great accuracy, and the biomedical establishment is beginning to develop, and in some cases has developed, some therapies out of that information. So that part has actually really worked. The problem is the common diseases that millions of people get, and the genetic impact, as opposed to, say, the environmental impact, tends to be rather small. Those are the ones we're still working on. I'm optimistic that the world will change dramatically, say, in the next decade. And hopefully we'll do it the right way. And like in all technologies, there's a good way to do it and a not so good way to do it. And the good way to do this is to have a lot of protections in place for things like discrimination and privacy. We shouldn't be coerced to use this information. That's another interesting issue. Somebody who has a high risk for a particular disease might be excluded from a job or be forced to take treatment for that, for instance. So I think there's a lot of kinks to be worked out, if you will, to make sure this goes correctly. But especially when you start combining with genetics a greater knowledge of environmental risk factors, the way the brain works, lots of other areas of biomedical research, I think we're going to have a really interesting world where we'll have a lot of predictions, a lot of forecasts of our future, and it'll be very strange to us and probably even our children, but by the time our grandchildren come along, it's going to be no different probably than getting a cholesterol test or any number of other tests that our parents and grandparents thought was strange and we think is normal.